Thank you so much for your valuable insights this evening. Dr. Jerome Kim, Director General of the International Vaccine Institute. Hope we can have you again for a lengthy discussion on this topic. Thank you so much.
Thank you.
Now, with the number of novel coronavirus cases over 115,000 and more than 4,000 fatalities worldwide, researchers, biotech companies, universities, and government agencies are scrambling for a vaccine to contain it. Are we close to a COVID-19 vaccine? Is there hope of securing one and rolling that out across the population in time for this outbreak? The topic of our News in Depth with Dr. Jerome Kim, Director General of International Vaccine Institute. Dr. Kim, thank you for coming to the program.
It's my pleasure. Thank you.
Now, first of all, how big is the threat of COVID-19 here in South Korea and worldwide now?
So I think everyone has been tracking the figures every day, and it looks like Korea has done well over the past several days, although again, you can't tell from looking at it from day to day. You have to look at it as a trend over time. In the rest of the world, however, the outbreak looks worse. I mean, Italy, Iran, the United States, France and Germany. It looks like the measures that had worked in Korea are going to need to be applied systematically in other countries of the world.
Now, do you mean the testing, early testing?
Early testing, isolation of people. And in Korea, when the government told people to stay indoors, they often did that. It may be more difficult in other countries. I mean, it might be very difficult. I'm an American, and I'm not sure that Americans would stay indoors if the government said, isolate yourself. So I think, countries will try. And even in Korea, it's not over. I mean, the vast majority of Koreans haven't been exposed to the virus, and it could come back.
Right. So given the slowing pace of the daily increase in South Korea, like we've been witnessing, some here have been cautiously hoping for that the peak, at least in this country, has passed. However, we did see cluster infections happening here and there, and the largest one so far that we've seen here in Seoul today. Would you agree that we are reaching a peak, at least?
I think we always hope for the best, but as global health people, as public health people, you have to prepare for the worst.
Right.
So although there's reason for some optimism, I think, the government in Korea and the governments all over the world have to stay on guard. They have to be able to detect new infections quickly and act on them quickly.
Right. The SARS-CoV-2 novel coronavirus that causes COVID-19, what scientists know about the virus so far? I mean, what about this concerns you the most?
So about the virus itself, I think it's for instance, with SARS, the first SARS epidemic that occurred in 2003, the people who were transmitting typically were people who were very sick. So you knew who they were, you could isolate them. Part of the problem with this particular SARS-CoV-2 is that people can actually start transmitting the disease before they really show symptoms, or they'll show minimal symptoms. So you could just think, well, I'm feeling tired, or my joints are aching, my throat is sore because I was talking too much yesterday. At the same time, if you are infected, those could be the earliest signs that you are infected, and you may be infectious at that point. And so it's the idea that people who aren't aware that they're sick are walking around and talking to people or doing things that they normally do during the day that really makes this disease a little more difficult and a little more like the flu that we have difficulty controlling even under the best of circumstances.
So I guess people being able to transmit this disease without you yourself knowing it is the biggest problem.
Correct.
The tricky
Exactly.
part. So how does COVID-19 compare to SARS-CoV or MERS-CoV in case fatality ratio or transmissibility?
So it's easiest to talk about fatality rates first, case fatality rates. So MERS is definitely the most lethal. It kills 30 to 40% of people. In Korea, it was only 20%, but I think, again, that was because the Korean government did a remarkable job of screening people. So we actually picked up people with mild infection. So the actual death rate looked lower. So with SARS, the death rate is about 10%. And with the new SARS-CoV-2, it's probably under 2%. In Wuhan, it was 3%. outside of Wuhan in China, it was under 1%. And it's very similar then to the rate in Korea. I think what we're seeing now in the United States and in Italy may be that they haven't identified the entire population of people who've been infected.
Right. So right now in South Korea, it's about 0.7%. However, of course, the denominator could change and the numerator could also change because we haven't seen the entire disease spread out just yet, span out before our eyes. Now, do you fear the novel coronavirus could end up being on the scale of the Spanish flu even worldwide?
So that's what we have to make sure it never does. You know, it has the potential to spread. And I think we've seen it several times. I mean, we weren't expecting an outbreak in Korea. You went from 30 cases to 1,000 cases in a very short period of time.
Right.
The United States, Italy has been like an explosion of cases. So I think, and this should remind us that even though, again, in China and Korea, it looks like the outbreak may be subsiding, you still have to be very vigilant because if a person happens to travel back from the United States or back from Italy or back from somewhere in Europe where they were exposed and infected, they could easily come back here and the whole thing could start again.
So we have to make sure that it doesn't, we block the inflow of, I guess, infectious diseases back to the country?
So that's a very difficult thing to do. Because, you know, we live in a society that is by nature interconnected and interdependent. Our economies are enormously interconnected and dependent. So, you know, blocking all travel is something that you have to do after looking at all the data and really understanding where the risk of transmission is. And, you know, the other thing is it's current. Because if you looked at this epidemic 3 weeks ago, you might have said something different from what you're saying now.
Right.
And certainly, for instance, in Australia or Singapore or some of the countries that have now blocked the entry of people from Korea or put them in isolation, I mean, their governments have to look at the Korean data. And in a week or two, we'll need to look at the data again because the situation in Korea is not the same as it was last week.
Now, so as the coronavirus outbreak continues to spread around the world, researchers have been scrambling to bring various treatment to clinical trials. Only a few are showing hope to success for this particular virus, including the former Ebola drug, I believe, this particular drug. Until a vaccine is ready, what kind of treatments are there for this disease?
So I think compared to Ebola, for instance, the good news is that, you know, the case fatality rate in Korea is under 1%. So you have to actually now be careful because without doing anything other than giving people the support they need in order to not get sicker, 99% of people will improve on their own. I mean, they may be 5% may be very sick and in an intensive care unit, but by and large, 80% of people will hardly show any symptoms and will recover spontaneously. So when we look at the drugs, we have to really make sure that they actually work to reduce the length of disease or the severity of disease. And that's something that we can only do in properly done clinical trials. And I think that it's been announced that the Chinese government will have some results from some of those early clinical trials this month. I know that the United States NIH is talking to institutions in Korea on the worldwide testing of remdesivir, which is one of those drugs that worked for Ebola.
Right.
And hopefully we'll have definitive evidence that it actually works and impacts the disease. And that will be great news for people who are suffering from the illness.
So if that decision or if that is made, when can the ill receive that drug so that they can be treated?
So depending on the amount that the company, in this case Gilead, has on hand, you know, before a drug can be used, it has to be approved by the Ministry of Food and Drug Safety in Korea or the Food and Drug Administration in the United States. And that process does take some time. It will be expedited. But the agency has to review all the safety data as well as the fact that it works and really make sure that they're approving it for the right reason. They'll do it quickly because there's some urgency in this situation. So I don't think there will be any doubt that the regulatory agencies around the world will move quickly on both vaccines and drugs to get the right things tested and to get them approved if they work.
Now, Dr. Kim, treatment drugs treat and cure sicknesses, while preventive vaccines don't treat and cure sicknesses. They prime your immune system to fight a potential disease.
Right.
Now, there's currently no vaccine available to protect people against this disease, but when will this change? I mean, how do you create a vaccine?
So that's a great point. We give vaccines to people who are well, to keep them well. It's different when you're giving a drug to someone who's sick in the expectation that they'll get better. So for vaccines, we have a very low tolerance for problems with safety. If we give you a vaccine, we want it to be safe and effective. We want it to be, not cause any side effects, and we want it to protect you against the illness. So that typically means that the average drug takes 5 to 10 years the average vaccine takes 5 to 10 years to develop. And some of the big companies like GlaxoSmithKline and Merck will say that it's $500 million to $1 billion to develop a vaccine.
Right.
We don't have the luxury of time here. And it has been shown. I mean, Merck developed the vaccine for Ebola in a very short period of time. So given the right circumstances and the urgency of the situation, you can accelerate timelines around testing and approval. That being said, Dr. Fauci, Anthony Fauci, who's the director of the National Institute for Allergy and Infectious Disease, said, it'll be 12 months before we know that it works. And it'll probably be additional months before we actually have it available for use in clinics. But that's remarkably fast for vaccines that usually take 5 to 10 years to develop.
Right, so 12 to 18 months, that's compared to 15 years, like you said, that's remarkably fast, I suppose. But, I mean, is that still fast enough? I mean, is there hope of securing this vaccine and rolling that out in this population in time for this outbreak?
So I think that gets to where you think the outbreak is going to go. And I think quite a few of us now are worried that this will persist.
And become an endemic, like the flu?
So it could become endemic, but it probably, because it's a coronavirus, and again, we're guessing because we don't know enough about the way this coronavirus will change itself over time, there's a suspicion that, it will go into a setting where the next SARS-CoV-2-like virus that comes out may be slightly modified, like the flu. I mean, the strains that are present this year are not present or may be modified next year, and we have to have a new vaccine. So we don't know. We don't know enough about this. And so part of this we'll have to keep track of it over time.
So what good will a vaccine do if a virus mutates, like you said?
So there are a lot of viruses that have mutations and bacteria for things like pneumonia. And so a few of the things that we can do is we can use more than one vaccine, as we do with the flu. There are either 3 or 4 vaccines in the flu vaccine that we normally get. Sometimes we'll find a vaccine that actually protects against multiple strains of the virus, because the part of the vaccine that is the most important, we call it the antigen, the thing that actually stimulates the body's defensive response, could be conserved. And that would be the best situation, and I'm not sure that we'll be able to do it because we aren't often successful. But for the future, that's where we should aim. I mean, for a vaccine that will be broadly protective against this coronavirus and others. In fact, there's some preliminary data that vaccines that might have been developed for the original SARS virus might actually protect against this one. But none of it's been done in humans.
Right, that's what I've heard. So will that be done though? Will you try that in humans and then come up with the vaccine? So
there are a number of different approaches that are being used now. Probably the fastest are what we call DNA and RNA, nucleic acid or genetic vaccines. And the reason is that, basically 3 hours after the Chinese published the sequence of the virus, companies around the world had identified exactly what they wanted to put in the vaccine, modified it so that it would work better in humans and get good, theoretically develop good responses. And within a week, they were testing it in animals. So, in the next couple of weeks, some of these companies will already have data that it generates what we want in animals. And some of those companies, for instance, Moderna, announced that trials could start as early as this month in the United States. And other companies are not far behind. So
And so very briefly, last but not least, how much hope do you have for this strain of the coronavirus?
So I think we will eventually get a vaccine, and it may be, we may have a proof of concept that a vaccine actually protects against infection at the end of the year. Maybe a little before, but that still means that, the clinical trial needs to be reviewed by the Ministry of Food and Drug Safety in Korea or the FDA in the United States. They'd have to approve it. There needs to be a recommendation to use it, which, requires a different group of people to make a decision to recommend it. For a lot of what IVI works on, that means the World Health Organization has to gather a group of experts, and that group of experts will make an official recommendation. Countries around the world should use this vaccine. So that takes a little bit of time. And then the company, at the same time, once they have the data that it works, they're probably going to start gearing up production. And sometimes that takes a long time. You have to build a new factory. You have to do all the quality things to make sure the factory will make things properly. The advantage to DNA and RNA is you can make a lot of it very quickly. And that actually is the one piece of really, of potentially the silver lining in this otherwise rather dark cloud is that some of these genetic vaccines can be made in large quantity very quickly.
All right. Well, thank you so much for your valuable insights this evening, Dr. Jerome Kim, Director General of the International Vaccine Institute. Hope we can have you again for a lengthy discussion on this topic. Thank you so much.
Thank you.